Perfect. So I'll just take, they've got a courtyard. When you come out of the elevator, you've got a waiting room. To your left and to your right would be the entrance to the surgery center. Stairwell is right there. There's a courtyard as we walk through a rectangular aspect of it. We've got your standard front office scenario. And there's a view from that angle. And then as you walk your way through here, you have a variety of different offices. Business office. Down this corridor you have exam lanes. One exam lane. And another. Standard exam room size. A third. And you have like an office employee only lounge. Overlooks the courtyard. Again, looking back during the entryway we came. What's called a video education room, so you can do patient counseling in here. This could be an exam lane, this could be an office. You probably have what the doctor's office originally here. This was Dr. Carley's office. Then you have what they term a procedure room. It's a pretty spacious procedure room. Very nice, actually. All the accoutrements of a standard small procedure room. Again, now looking back to the end of this corridor, you got double doors that'll lead you into the surgical component. You've got a men's and women's dressing room. Back in the day when Medicare required showers, they got it all Medicare certified built because Medicare required showers back in the day. Even in the women's room, you can see it was used for some storage as well. All the electrical panels. Back over here, you get your med gases. That's any soil trash in here, not med gases. Sharpies and med waste. All your biohazard. Now, walking into the surgical suite. And you've got like the standard clean and dirty areas all separated out. Sterilizer. You got a pass-through window to the other room over here. So you have a separated out clean and dirty area. Again, this is the door we just came through. It's called an anesthesia room. Mostly a supply room. You have a traditional central storage area. You never have enough storage in a surgery center, so this helps out a lot. Here are your scrub sinks, pedal activated, both with window access to the ORs. Red line areas here. You have basically two pre-op and two post-op beds. Well, actually, take that back. You technically have 6 beds. You can have 4 on this side and 2 on this side. So technically you can have 6. It'd be tight for 6, but you can technically legally do 6. Nurse's station. Now I'm working my way back to where we started, actually, because you've got an administrative office for the surgery center. And this would be technically the exam room for the surgery center. And as you can see, as we walk our way out here, this is where we started, back at the elevator. So if you came out of the elevator, you can go left for the doctor's office or straight through this door into check-in for the surgery center. Back little administrative office back here if needed. So patients would essentially check in here, then be brought back through these doors. There's a changing room, a locker in here. So this is their changing room, bathroom, fully compliant. Again, 2 beds, 4 beds. Cross the red line. So you're coming out, cross the red line into OR1. And traditional good size OR. As you can see. Nice dimension to it. Nice size. And this is the second OR. A little smaller than the other one. But then, of course, there's a little more in here. They're pretty dimensionally not radically different. I'd say OR1's a tad larger, which is probably why they used OR1 predominantly and used OR2 when needed. Then again, for patient discharge purposes, back down this corridor and out to the elevator. And that's the tour.